This is Abraham Obile Wanyama in charge of corporate wellness. Today we have a range of services in partnership with our partner Taria Health. Taria Health is a team that we work with in matters of chronic disease management and of course reviews of patients that we handle on our daily basis. We are all out here to support the community and the church. Much blessings and of course support from the church to make this day a big success. At Pathcare we have two ways. Like I just mentioned, we have the diagnostic approach and the screening approach. Today we are doing basic screening, but more importantly we also do a lot of diagnostics. Diagnostics is when patients come in to understand what is ailing them, but screening is to do what we call preventive health, so they can understand if there are risks or the challenges they are likely to face. So like for us in corporate wellness we do basic screening, but for other services we do diagnostics where patients come in through referral of doctors and consultants to understand their stage or their condition or what's ailing in matters of cancer. And like I said, there are also different types of cancer, like for men, I know the risk is always the PSA, prostate cancer. Prostate cancer where we offer tests like PSA for men, especially men above 40. For women, I'm sure the scourge is real on cervical cancer, breast cancer, but for both men and women, we also have colon cancer plus other types of cancer. So today we are trying to focus so much on PSA and testing for prostate and cervical cancer screening through our partners who are also here today. So at Pathcare we have a range of those tests that we do support those who visit us, and we encourage them to really come out in big numbers and get themselves screened and checked to avoid late coming, so that the scourge could have had a lot of impact on them. Thank you. We have a lot of tests, or rather services that do comprehensive checks, kidney function tests, full blood count tests, we have liver function tests, we have cardiovascular issues that we also try to check. More importantly about reach, we have a lot of opportunities for them to reach us. We have a WhatsApp platform through the numbers that you see. Just like you've also mentioned, you see this is our 011 121 500 is our common line that we use. We have an interactive call center 24 hours, and more importantly, like I talked about, we also have a partner there who does what we call online reviews. So we have developed Taria as our telemed platform for reviews of tests that we do. So for all the patients, for all the staff that reach out to us in both corporate and retail wellness, we reach out to them, we call them. We have a team of doctors who review these patients through phone calls. We also do emails of the reports to each and every patient who visits us almost immediately, so that they can at least give them prompt response. But more importantly about our website, we also, yes, they can visit our website, check the tests, check the price, and even book online. So those are the platforms we're going to. But also, like I said, we are also ready to listen. That's why we are out here to listen to more. If there are other requests maybe you need, we can integrate so well in our systems to serve them well. Thank you. For the last 5 years, this coach is actually getting towards what we call chronic disease management. Chronic diseases are diseases that don't show early signs. Yes, like I talk about this is like diabetes, talk about stroke, maybe those are cardiovascular issues, heart issues. These are conditions that maybe out of nutrition or out of the environment we are in, they develop slowly. So by the time you maybe get referred by a doctor, it's already late. Like now talk about cancer, the matters of referral for cancer is always up to, like yesterday we had a very good talk on referral. Most patients who come to hospital for treatment of cancer is always at stage 4. That's a bit extended, but that's why we are coming out here to screen. Screening now means we want to have what we call early detection. So for us, we are trying to develop a platform where early detection is the key to preventing and even softening this scourge in the community. But more important, just good to understand that chronic disease management, like for example, those conditions of asthma, diabetes, those are the real issues that are even not just affecting us, but even affect families, because they are very expensive to manage even in hospitals. So we want to encourage people to come out in large numbers and get screened as early as possible, so they can at least manage the process. But also more importantly, guide them, like I've talked about nutrition. Nutrition is key to some of these conditions in matters of management. That's why we are here talking about it. But also, like I said, family issues that are affected by this, that we want to also family members to understand that when someone is diagnosed of cancer at whatever level, that it's all manageable. that they don't have to give up and say maybe this is the end of life. Thank you. Everybody is a doctor. So one, they'll talk about sugar, they'll talk about salt, they'll talk about exercise. But one, as Pathcare and our colleagues here, we are trying to guide them on what type of food, like for example, on a simple plate, in terms of balanced diet, how are we supposed to balance? But we're trying to draw them back to the early days of nutrition, where, for example, we were able, like when we were young, our grandfathers could be able to tell a whole plate. A whole plate is made of maybe the carbohydrates we know, the greens we know, the proteins we know. For example, some egg, some cowpeas, maybe some msheveve, and maybe some ugali that we just plucked from there. And like right now, most of us are shopping from the supermarkets, highly processed foods, which sometimes do not give us the best. So we're looking at this in matters of how comparison to what we had and what we're having today. And also too, very important about this sedentary lifestyle. Most of our people, most of our customers are working 9 to 5 or rather even 8 to 5. So they don't have much time to go out there and look for fresh food. So they are relying on supplies. Some of us are buying from can you talk about maybe these latest groceries or cafes where there are a lot of food that might not really be able to, they are so spiced and all that, so that they really affect the balancing of our metabolism. So those are the real challenges in terms of matters of nutrition. But also other aspects that we are trying to look at, we are trying now to address the issues of movement or exercise. That, for example, people working 9 to 5, how can they have time to at least check on their body matters of movement? For us, movement is key because it actually stimulates the body system and, of course, helps someone to at least have some cut in matters of cholesterol. Remember, cholesterol is key to some of these. And, of course, there are two aspects. There's the bad cholesterol and the good cholesterol. The bad cholesterol actually is what brings about these challenges of heart diseases. That's an area that we're trying to really address in matters of an aspect of wellness. Thank you. On venereal diseases, that's HIV, STIs and UTIs, we being a healthcare provider, we are so bold about it in matters of health talks. We are giving open health talks, but also too, we don't practice stigmatization. We open up, and that's why you see at levels of interaction or consultation, there's a lot of privacy where doctors listen. But more importantly is that if someone is affected, we encourage them to be given some proper referrals for checkup to confirm, so that one, I don't have to hide in the house if I'm affected. But clearly also true is that at least we are trying to encourage people to come out and talk about it, but give them safe spaces. As a healthcare provider, the safe space is real, that they can come out and be checked and be supported. And also very important, we are trying to support them by sending them to maybe facilities that give free services or other free medication for that. But more importantly, we are ready to support, let them come in, check themselves, especially for couples who are maybe suspicious of each other. And thus we also encourage those who walk in. So we join, for example, the WHO days where maybe matters of health or sexual health is concerned, to offer those free services, and I may most likely also give guiding and counseling. But at the back of our end is that we have personal privacy, data privacy, and the results are given to individuals. So we don't have to publicize. You don't have to make it a stigmatized point, but we are open up to support and hear out their concern and address them. So we give them a platform where they can be supported, guided, and even treated. So all those conditions can be supported and treated at the same time. Thank you. Yes, we do DNA testing with a lot of protocols around, just like any other test. We respect those who are coming, and actually, as sensitive as you might think, parents have a right to know. Parents have a right, and of course, DNA testing has so many aspects. Just like when you're talking about testing parentage. So for us, we do DNA, but we don't stigmatize, so that someone does not come looking for evidence or reason to punish, to divorce, or to separate. No. We give, just like we talked about the earlier point, we look at the protocols around it with a lot of respect to parents, the children, privacy, security, and safety. So we, just like the guidelines from the ministry, their respect to the parents, and we would encourage if both parents could come and give consent for the process to go on. But also very important is that the child must be protected in this respect. Kenya is a country that is very well entangled with issues to do with the healthcare and matters cost. So for us, we are promoting early detection. Early detection of any condition or disease is cheaper than treating it. And of course, you know, like today we have a partner, Jubilee Insurance. Insurance in Kenya is actually, we are basically underinsured, but we are looking at ways where we can manage it before we go to hospitals. So to avoid the expenses and the cost and the trauma around the treatment and management, we recommend that early detection of any condition is better than, just like we know the common adage in healthcare, prevention is better than cure. And that's why we are here today, to screen and help them prevent themselves before they go in the costs of hospital bills. Thank you.